think about that. So I welcome you all, and if you have anything, means you have, if anyone is interested to present in the today's session, please, yeah, please you raise your hands, or you can type in a chat box. My case report is ready. We will present like that. So please, the session is open to all. So you have to participate very actively, because it's not like it's like some kind of Tadvidya Sambhasha, we can call it as, because the all the people having a little bit knowledge, because I'm not a fulfill with almost all the knowledge. So it's because of their valuable outcomes and inputs is needed. So anyone is ready, please raise your hands, or can put a message in a chat box to discuss regarding the case report.
Dr. Anuja will present the case.
Yes, sir. Yes. Sure, sir. Dr. Anuja, ma'am.
Start
Yeah.
presenting the
Yes.
case.
Yes, sir.
You can start directly with the case without showing, means your name, just you tell your name and designation and start, move to the first slide.
Okay, sir.
Dr. Anuja, please share your screen also.
Okay, sir.
We have to make her co-host. I
Yes.
will make,
Yes.
sir.
Sir, I will share the PPT, sir. So,
Why? I am making her co-host. She has to present. Anuja, you can share now. You are co-host.
Yes, sir.
Start. Don't waste the time. If somebody have prepared the PPT, then you will be taken next second number 2 case presentation. Please share your name in chat box if your PPT is ready. Next week we will put tomorrow itself link everything. Please.
Yes, tomorrow, and if anyone is ready to present, or
Every
anyone
Sunday
is
it will be
interested,
there.
yes, sir. In 2 days, they have to send
This time
the
we have
outline
given
of the study.
short notice.
Yes.
Next time we will give well within, means we have told no. Every Sunday will.
Yes.
If somebody will be there, even if I am not there, somebody will be there. And Suresh sir, experts, you have to take 2 to 3 days before. Who will be the chairperson?
Yes, sir. Sure.
At least experts, the chairperson in the sense, the experts, 2 to 3
Yes.
minimum experts needed. Along
Okay.
with you also, moderator as well as expert.
Yes, sir. Sure, sir. Sure.
You can share your views also.
Yes, sure.
Some senior means faculties have joined, then you can make him as expert. If you
Yes. Yeah.
find
Sure.
him as a seniors, then
Hmm.
they can send chat not openly to us.
Directly.
When
Yes.
senior is present in this, we don't know, then they can send chat in the chat box. We will make them expert.
Oh.
You have to ask their opinion first.
Yes.
All the
Yeah.
experts. Then open for all. Open for all.
Yes, sir. Yes. I request any of senior faculties who are presented in this today's webinar, please send directly in a chat box, send directly message to us. Your valuable opinion is needed regarding the case report. Thank you.
Anuja, start your
Dr. Anuja, start presentation.
Yes, sir.
Any difficulty? We'll present here. Shall I present?
Yes, sir.
Why? What is the problem?
Screen share ಆಗ್ತಿಲ್ಲ sir.
Good. ಆಯ್ತು ಮೊದಲೇ ಹೇಳ್ಬೇಕು ಅದನ್ನ ನೀವು. ಸ್ಟಾರ್ಟ್ ನಾವು. ಸ್ಟಾರ್ಟ್ ಮಾಡಮ್ಮ. ಅನುಜಾ ಸ್ಟಾರ್ಟ್.
No, sir. She left. Again, she is trying to join.
Sudhar, you can start presenting, no? I will maximize it.
Yes, sir.
Now it is maximized. Full view. You can start.
Yes,
Yes,
sir.
sir.
This is
Good
continue.
morning, everyone. Sir, am I audible?
Yes, you are audible. You are audible.
Okay, sir. So, good afternoon, everyone. Myself, Dr. Anuja Daga, second year PG scholar, Department of Panchakarma, Ayurveda Mahavidyalaya, Hubli. Today, I am going to present a diagnostic and treatment challenging case study. So, moving to the first slide. Introduction. A 37-year-old female presenting with complaints of progressively increased number of reddish pus, blood-filled eruptions over back, buttock, and thigh, with a duration of 4-year chronicity. Patient approached in a dilemma of whether this will be treated or cured or not, as her past treatment were not fruitful. So this was the main reason to present this case. Patient profile: 37-year female with occupation as housewife, came with the chief complaints of reddish eruptions over back region, buttock region, and bilateral thigh. These eruptions were increased during menstruation since last 4 years, and with no specific comorbidities were noted. During clinical presentation, the symptoms were of reddish eruptions, same, and they were associated with severe itching and burning sensation. On clinical findings, the onset was gradual, initially with few eruptions, that is 5 to 6 eruptions were noted, and there was pus and blood discharge, and progression was gradually the lesions were increasing in the number, with more predominantly or more focusing on premenstrual flare-up, with no facial involvement of the lesions were noted.
Over, no?
Yes, sir.
Then you can everything you have told, no? History, everything.
History with clinical findings and more particular symptoms I have displayed. Anyone can guess the diagnosis, or at least differential diagnosis can be shared.
So case presentation, while presenting case, do not write the disease name in the title slide. So always, till that diagnosis or differential diagnosis, disease name should not be revealed to the audience, okay, participants, so that they can actively participate and find their different either probable diagnosis or final diagnosis, whatever it is. That's how we have to create the intuition or curiosity among the participants. You can modern diagnosis, Ayurvedic diagnosis, whatever it is there, you can express, no? Based on the symptoms.
All the participant, it is an open discussion. Please share your thoughts or diagnosis regarding this condition. Yeah, chat box is open.
Anuja, based on symptoms, which the first symptoms, which are the predominant symptoms, and associated symptoms you are not 3 plus or 2 plus you are not made, no, yet. Which is the
Itching,
predominant?
sir, at the baseline, burning sensation, and other all the symptoms were at 2 plus.
Next slide. Differential diagnosis, read.
Differential diagnosis. Three conditions, that is acneiform eruptions, acne vulgaris, and hidradenitis suppurativa. The site of the lesions or eruptions which are present in acneiform eruptions are all over the body and not just on the face, which are more common or more particular in acne vulgaris, which is present more on face, chest, and upper back region. In hidradenitis suppurativa, the lesions will be present at axilla, groin, perianal, and inframammary region. And causative factor in acneiform eruption will be more on increased androgen productions, and acne vulgaris itself is a causative factor for acneiform eruption. Whereas in acne vulgaris, the causative factor is due to increased sebum excretion or increased sebum secretion along with increased androgen productions. Whereas in hidradenitis suppurativa, systematic metabolic disorders such as metabolic syndrome, obesity are the chief causative factors. And sinus tract will be present in acne vulgaris as well as hidradenitis suppurativa in chronic stages, which will be absent in acneiform eruptions, and there will be no comedons noted in acneiform eruption as compared to acne vulgaris as well as hidradenitis suppurativa. The type of the lesion acneiform eruption will be papules, pustules, and nodules, whereas in acne vulgaris, blackheads, whiteheads will be present, and deep nodules and abscess formation will be more in hidradenitis suppurativa. Next slide, sir.
What is the final diagnosis now? Any guess from the
Acneiform eruption is, Sir Dr. Swati Rawat is, she has messaged that acneiform eruption.
next?
Okay, any other?
It's okay, sir. Next.
Yes, sir. Sure.
They have to speak. They have to unmute themselves and to speak. Okay.
Coming to
Right.
diagnosis, based on the chronicity as well as the nature of lesions, Chirapaki, Kandu Bahulata, kapha predominancy can be assessed, and Daha, Raga, and Puyotpati denotes the association of Pitta. So this condition was diagnosed as Kapha Pittaja Pidaka, and according to modern, based on the progression and discharge, the diagnosis points towards acneiform eruption according to modern science.
Not only discharge, the site of the lesions and the its many all those things. No,
Yes, sir.
other than the face, it is involving. Spare means it is spared. Face is spared, and apocrine access area means axilla, groin is spared. Other all body parts are involved.
Yes, sir.
Whereas HS, hidradenitis suppurativa, it involves apocrine gland rich area like axilla and groin, and sinus tract formation always will be there. Those are the things. Hence, it is acneiform eruption. And this one, HS is also called acne inversa. Acne inversa means it sinus tract will go inside. Inversa means it goes not to the superficial and deep. That's why acne inversa it is name. Okay. Next.
Management or management bar intervention. So initially, Sadhya Virechana was given with a duration of with a gap of 15 days. 2 sittings of Sadhya Virechana was given to this patient. Later, Sadhya Vamana was planned and followed by Vamana Sneha Svedana Purvaka Vamana, and at last Siraveda was performed. And during Sadhya Virechana, phase 1, phase 2 Shamana Aushadhi were given. That is Guduchadi Kashaya, Sirap Sarivadhyasava, Arogyavardhini Vati and Kamaduga Rasa in phase 1. And phase 2 Sarivadhyasava, Arogyavardhini Vati, Bruhat Gandhaka Rasayana and Sirap Aragvadadi Kashaya along with Sadhya Virechana was given. And post Sadhya Vamana and Vamana, phase 3 oral medications were prescribed, that is tablet Kaishara Gugulu, Cheria Madusnuhi Rasayana, Syrup Khadirarishta, Patola Katurohinyadi Kashayan, Nalpamaradi Taila for external application. After phase 3 medications, Siraveda was performed. But this Patya and Apatya was advised to the patient, focusing on Kushta as well as in order to detoxify the liver, which is a moola of Raktavaha Srotas. So following Patya and Apatya was advised to the patient. These are the oral medications which were prescribed along with its dose, Aushadha Sevana Kala and Anupana.
You can read it out.
Tablet Guduchadi Kashaya 1 TID with before food with a Sukoshna Jala as Anupana. Tablet Arogyavardhini Vati 1 TID before food. Syrup Sarivadhyasava 15 ml BD after food. Tablet Kamaduga Rasa 1 TID before food. So this is phase 1 Shamana Aushadhi. Bruhat Gandhaka Rasayana Syrup Aragvadadi Bruhat Gandhaka Rasayana 1 TID after food. Syrup Aragvadadi Kashaya 10 ml TID before food. This is phase 2 medications. Then after post Vamana medication, that is Kaishara Gugulu 1 BD after food. Cheria Madusnuhi Rasayana half teaspoon BD at 7 AM and evening at 6 PM. Syrup Khadirarishta 10 ml TID after food. Patola Katurohini Adi Kashaya 10 ml TID before food. So this is the outcome and follow-up of this case. On 0th day, you can the image of the lesion was captured, which was almost improved on 150th day after the treatment. And on the right side, these are the objective parameters which were noted during every follow-up. Initially, at the baseline, itching, which was at a 3+ was nil after the treatment. Burning sensation, acne, redness, scar, and pus discharge, which were at 2+ at the baseline, were almost nil after the treatment. The dermatological life quality index scoring, which was noted at the baseline, which was at the score 39, and subsequently before Shodhana, one more reading was taken, and which was at score 18, and which was totally reduced at score 5 after the treatment. So patient feedback. Patient was hesitant to face the social circle as she was unable to answer the questions which were asked by the people. By this, her confidence was lowered. After the treatment and with proper counseling, her confidence regained and her quality of her mental status was improved. Discussion. This case was a diagnostic challenge because of chronic nature and varied presentation. It was diagnosed on the principles of Kushta diagnosis, which was advocated by Maharshi Charaka. The treatment protocol was planned based on the condition of patient, dosha avastha and rogabala. Samprapti Vigatana was rationalized based on Kushta Chikitsa Siddhanta according to Maharshi Charaka, and out-of-box thinking approach was made by planning Sadhya Vamana before Sneha Svedana Purvaka Vaman. So this is a table showing Samprapti Vigatana Chikitsa. Samprapti Vigatana therapy by Sadhya Vamana, elimination of Bahu Kapha and Madhyama Pitta. By Vamana Karma, Samula Nashana of Bahu Kapha and Madhyama Pitta was done. By Rakta Mokshana, Shesha Dosha Nashana along with Yakrit Shodhana was achieved. And by Shamana Aushadhi, Kapha Pitta Shamaka, Pitta Rechana, Rakta Prasadana and Yakrit Shodhana was done. Nidana Parivarjana and Naimitika Rasayana was given to prevent Dosa Shanchaya and Rakta Dushti. Conclusion. This 4-year chronic Kapha Pittaja Pidaka is administered rationally with Sadhya Virechana. So usually when Sadhya Virechana was planned initially in two sittings with the duration of 15 days along with simultaneous administration of Shaman Aushadhi, it was noted that Pitta was expelled out, but the quantity of the Kapha was more as compared to the Pitta. So no significant improvement was noted initially. So considering the dosha avastha, that is Baudosha avastha of the Kapha, as well as the sthana of the dosha, that is in Urdhva Bhaga, Sadhya Vamana was planned in later phase, then followed by Snehana Svedana Purvaka Vamana, and Siraveda, Shaman Aushadhi, Naimitika Rasayana and Patya Patya for 5 months. This leads to 80% reduction in eruptions and marked relief of chief symptoms, itching and burning sensation with subsequent reduction in pus and blood discharge. The key observation of this case was a significant decrease in dermatological life quality index score from 39 to 5. No adverse reaction were noted during the treatment. This case highlights the potential of Ayurvedic approach by integrating different modalities rationally, which helped in successful management of Kapha Pittaja Pidaka. Thank you.
Now the case is open for discussion. You may ask the questions for the presenter. If you want any clarifications or doubts, you can ask the questions.
The participant, please unmute yourself and you can ask questions also. Yeah. One question is in a chat box from Sujit Yadav. So how many days of Shamanaushadhi was given to the patient? Yeah. Presenter, please clarify regarding this thing.
3 months of Shamanaushadhi was given to the patient, and during Sadhya Vamana and Vamana, no internal medication were given.
Okay, that Shamanaushadhi as in a different context, like phase 1, phase 2, and phase 3. Yes, is it
Yes,
right?
sir. Yes. Yes,
Yeah.
sir.
Oh, okay, thank you.
Any questions directly you can ask. No chat box message, etc.
Yes, unmute yourself
Nothing will
and you can
happen.
ask the question.
You can ask question directly. You can ask in Hindi, English, Kannada, Telugu, Malayalam, or Gujarati, Sanskrit. Why? One thing I told, why Sadhyavamana? Why not Sadhyavamana is done at first initially? Why Sadhyavirechana has been given? Nobody is asking, no?
Yes, yes. Someone
Can
is
you
asked the question.
answer this?
Yes. Sir, Swati Rawat, she asked the question, for Sadhya Virechana, which medicine was used?
The Nimbamruta Eranda Taila with the dose
What is
of
the
60
dose? Dose, everything you have to dose.
dose of 60 according to her Koshta, and total number of Vegas were 5.
Okay. So, Dr. Swati Rawat, you can ask directly by unmuting yourself. Then only the discussion will happen in a fruitful manner. So don't use chat box. Directly ask. You can ask in Hindi also. You can ask in English. Okay?
नमस्ते नमस्ते सर।
हाँ बोलिए
सर,
डॉक्टर बोलिए।
हाँ सर, was the cause pitta vitiating hetus were there or kapha vitiating, sir, to ensure to do vamana first or virechana?
Presenter, answer this question. It is as a diagnosis itself, it is showing that, doctor, it is kapha pitta se pedka. So kapha predominance, bahudosha avastha was there, kapha, followed by anubandha dosha, pitta. So initially, Sadhyavamana is the best and apt choice for this, but patient denies for that. So we tried with the Virechana, Sadhya Virechana. Then after that, she agreed to Sadhya Virechana. There is no improvement, no significant improvement was not there. Then she become ready for Vamana. Then why we did Sadhya Vamana instead of Vamana, Sneha Svedapuraka Vamana? Because the itching was so severe that during Snehapana it will increase, one thing. And second thing, we have, because of itching, she is having reduced sleep, disturbed sleep, reduced sleep. Then again, Vata is also inducing the increase of this itching, everything. That's why we decided to go, that is classically Baudosha Avastha, Sneha Purvaka Vamana is there. But sometimes we have to think out of box, that of what I'm telling. Instantly you have to provide relief from that itching symptom and as well as burning sensation. Okay. That's why you decided that Sadhya Vamana will go first and then followed by classical Vamana. Okay. Sadhyavamana, as per our plan, we did Sadhyavamana. After 1 hour, immediately after 1 hour of Sadhyavamana, the itching 50% itching is subsided. Just immediately after Sadhyavamana. means 7:30 it is completed, no? By 8:30 the patient is having 50% improvement in itching, and the redness of the acne are reduced, and burning sensation is also reduced. So it shows that the action of Sadhyavamana is so quick that it can able to give the relief. So even though you cannot means it is as per classical advocation, Utkrishta dosha should be there. Here Utkrishta dosha is not there, but before giving classical Vamana, if you do this, there will be marked reduction in the itching. Then after that, if you give Snehapana, etc., she can able to tolerate the symptoms which aggravates during the Snehapana. That's how you have to think sometimes, not in all conditions, some like Shita Pitta. Even rashes or Shita Pitta, arterial rashes, I plan first Sadhyavamana, then classical Vamana or classical Virechana. That's how you have to plan based on the presentation of the case. If it is fit for Vamana, then you can go for Sadhyavamana. If it is not fit, then you go for Siraveda, and Virechana is the only choice left for you. This is how you have to think. Then after that classical Vamana, we did in the same case. Okay. Followed by the Naimittika Rasayanas and the Shamana Aushadhis as discussed has been given. Then Siraveda also 2 times it was done. 80 ml it is removed. Before the Siraveda also we have given Snehapana.
Okay, sir. Sir, what was the decision in means how Sarivadhyasava and Khadirarashta are different, sir? Both are used in itching, sir. Khadirarashta is Kledahara and best Kandugna. Why is it not used before Sarivadhyasava, sir? Sarivadhyasava used first, then at last Khadirarashta is used.
Both are Kapha Pitta we are taking consideration. That's why it has been used. Then later it has been means given predominance, means importance for that. Even Madhusmir Rasayana is also used because of that Kapha predominance only.
Okay, sir. Thank you, sir.
When more the Anubandhi dosha, based on Anubandhi dosha, etc., first cases we are given like that. Because eruption is more, Paka was more, then we thought that will subside Pitta also equally. It was nearly equal to the Kapha dosha. That's why. Then later it has been Kapha Pitta. Kapha predominantly we are taking care, and then as well as the Pitta.
I have few questions. Can I ask?
You can ask, please. You have to, before asking, you have to tell your name, designation, and where you are
myself, myself, Dr. Sujit Yadav from
previously
Mumbai.
Previously, who has spoken?
Yes, sir. Sir, myself, Dr. Ashwini Kabadi, sir. I'm a private.
Okay. Next.
Hello.
Dr. Sujit, tell me.
Yes. My question is there any typical history we got from this patient to get the proper nidan? Is there anything was wrong in Ahar, or anything wrong in Vihar, or anything she has gone through that because of that she has gone through this disease? Is there any typical history you have got, doctor? Hello. Hello.
Presenter, please answer the question.
Sir.
Dr. Anuja.
Yes, sir.
You can ask
Dadi, excessive intake of Dadi was only Nidana which we noted in this case. Other than that, no specific Nidana were noted.
Dadi was untimely, or she used to take only in some typical time, like in afternoon or at night, something like that, lunch or dinner?
No specific frequency she has noted mentioned, but regular intake of Dadi was there since long years.
Long years. Okay. My second question, what was the Gritapan you have used during this woman and giving, sorry, Virechan. Is there
Sadhya,
any?
No. You have
Okay, it
planned
was
for
Sadhya Virecha.
Shodhana. Yes.
Yes, for Shodhana.
Shodhana Mahatiktaka Grita was given for Snehapana.
Thank you.
Any other questions regarding this case?
I have a doubt regarding this, sir. Yeah, can you come, the presenter, Dr. Anuja, can you come across with any of the Garavisha like conditions in this patient? Dr. Anuja,
Yes.
any kind of like Garavisha or etc., any type of the poisonous something or any of the cosmetic related products or whatever the things. So can you come
No,
across with this or only Dadi or the Nidana?
only Dadi.
That will be there. You cannot deny, exclude, because pesticide contamination will be there in vegetables, everything. Routinely, everyone is consuming microplastics, pesticides, urea, etc. It will be there. You cannot deny. The relief
Because
found
only
because of
Dadi.
only. Because
Yes, sir.
relief found because of no, it is not like that, doctor. You cannot deny a role of other nidana. There will be definitely Rakta Dustikara nidana will be there. Other nidanas. You cannot take every 100 nidana, you cannot ask for every patient. Sometimes, but Dushi Vishi, it is there. Definitely, it will be there. Role of Dushi Visha will be there in majority of the cases. You cannot deny.
Yes,
So,
in majority of
you-
the dermatological cases, the
every,
Dushi
not only
Visha, yes, sir.
dermatological, I'm talking. Every
Yes, sir,
today,
yes.
why has CKD has increased? Say CKD because of Dushi Visha means here even you can go up to the modern all the antibiotics, paracetamol, all they are also Dushi Visha.
Dushivish, yes.
Even if you prepare Ayurvedic medicines, if it is not prepared according to the classical advocation, some shortcuts they are doing and they are adding chemicals for fermentation. That is also become some
Dushi.
shortcut. All they
Etc.
are,
Yes,
you
yes.
cannot say it as a Garavisha or Dushivisha. See, it is Sanyoga Visha. Ayuktija Sanyoga Visha it is. So you cannot make only one nidana, as you cannot say there are multiple nidana will be involved. But for the sake of nidana tyaga, you have to make definitely whether she has consumed or not. You have to tell what are the avoidable things. You have to definitely make the list and tell to the patients. Okay. Other than that, some other things will be there. Example, if it is noted Viruddha Visha, they are taking. Amata case if comes, I always insist to avoid fish and milk products, everything, all these. First thing I will advise. And milk plus rice boiled with salt or milk plus sour things, all these things, first I will advise to avoid this. Whether patient is taking or not taking. It is your duty to tell the pathe. In that way, you can, whether you have noted during the baseline which nidana is patient is taking, but it is your duty to tell to avoid the nidanas. Okay. Any other case is ready or we will wind up today?
Sir, some questions are still in a chat box.
Chat box I won't accept. Tell them to unmute and ask. Then only it will be, they will also get some.
Yeah, Dr. Swati Rawat, please can you ask this question? Whichever you have typed in the chat box, unmute yourself and ask the question.
This is not a big show that they should not have
Swati
fear,
Rawat?
etc. Hmm.
Okay, next, Piyush Gupta. Can you ask the questions which you have typed in chat box? Piyush Gupta, unmute yourself.
That will save time, our time, and as well as sometimes there will be spell mistakes, everything.
नमस्कार सर।
अरे पीयूष गुप्ता जी सीधा बात कीजिए ना आप, सीधी बात।
नमस्कार सर। नमस्कार सर।
नमस्कार नमस्कार, सीधी बात, तीखी बात, सत्य
जी
बात,
सर।
सभी ठीक है, सीधी बात
जी
कीजिए।
सर। सर कैन कुंजर क्रिया भी रिप्लेस बाय द शब्द वमन?
हाँ
कुंजर क्रिया इन षट कर्म कुंजर इज देयर, कुंजर क्रिया।
So that Vamana Dhavati,
Jala
Vamana,
Kriya,
yes.
you cannot compare every system as their own procedures. You cannot now means now you are talking about Nauli, Vastra Nauli or Lavana Jala Nauli.
Vamana
Lavana
Dhavati,
Jala
Vamana
ne
Dhavati.
which karma it is called?
कुंजल क्रिया।
वही षट कर्मा, among the षट कर्ma.
Yes, a कुंजर क्रिया is there
So
because
it's
it's
salt water they are taking and they are vomiting, no? That is or what it is? Or
Dauti.
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 Dauti, sir.
Or Nauli.
It is a
Which
Vamana
one it is?
Dhavati. Oh,
Nauli or
Dauti,
Dauti?
no
Dauti,
sir,
Dauti.
no sir, it's a kunjal kriya, kunjar kriya.
Means loose motion will occur after taking
No,
that.
no, that's a in Shankpichalan.
Hmm.
That is in
Sir, no.
Shankpichalan, loose motion there. Kunjal kriya is the stomach wash.
Stomach wash.
Same.
So
Same,
can
like,
it be replaced by Sadhyavan? And
Vamana Dhavati, sir.
what is the method of Sadhyavan? How to prepare the patient and how can which dose we can given to the patient in the morning?
You
Please
check
explain
you
us.
check my channel you are subscribed, no? Sadhyavamana is there. You go through that, the same method we are following. Okay.
Okay, sir. Thank you.
Madanphala we are giving, and usually I give curd and milk. Otherwise, if it is a Snigdha origin, Snigdha Nidhana Janya, Takra we are giving full stomach based on that. Okay. And before that, we are giving Yavagu added with Fanita and Guda for Sadhyo Doshotlesha. Okay. Nothing else, no Snepan, etc. Directly we are doing Sadhyamana on the same day.
Yes, sir. And
But
Patient is fit for Abhyanga Sveda, we are doing Abhyanga Sveda.
And afterward the Mulethi Bhupnopa.
Yes, same.
Okay, sir. Thank you, sir.
Only this is a case of skin means Kushta, no? We have added Kutaja in classical only. Kutaja, Indraya Bija.
Okay, sir. Thank you. Not Madanpal.
Madanphala is there.
But
Along with
added.
Kutaja,
Okay.
Bija.
Okay.
अमोघ ज्ञान अंदा.
Thank you, sir.
हाँ जी. Kunjal, you are asking about Kunjal and Sadhyamana. It cannot be, the action will be more, you found more action in Sadhyamana. No. Because you are using medicines here, they will reach all over the body because of their Vyavai guna, and because of their Vikashi guna, they will disintegrate. And Sukshma in nature, they will enter into the each and every cell of the body. That is Salla, and does the Shodhana. But the quantum of Shodhana compared to the classical Shodhana, Sadhyamana, it will be less. It will more act locally in the Amashaya, whereas the classical Omana will act, reach to each and every cells of the body and disintegrate the doshas and brings the doshas from all over the body. So that is the difference you can appreciate, because as I told, Sadhyavamana, if you do Kunjal, you cannot get such a improvement. As we noticed in this case, 50% reduction immediately after 1 hour after the Sadhyavamana. So that you can give, that is such result you can able to give in Shita Pitta and such a chronic skin disease, etc. it is possible in this Sadhyavamana only. Okay. And moreover, their naturopathy and yoga, they are using salt water. In this case, salt is usually Lavana Jala only Ayoga means expected Vega Pittanta. For Pittanta purpose, you have to use, not as a initially, directly. That is the difference of Ayurveda and Kunjal.
Okay, sir. Thank you, sir.
Good afternoon, sir.
हाँ बोलिए जी डॉक्टर साहब.
Sir, I wanted to know that why there was
Please
eruptions.
name.
Sorry, sir.
आपका शुभ नाम.
Sir, my name is Dr. Swati. Sir, I am a PG scholar here in Uttarakhand. Sir, I wanted to know why there was eruption more during menstrual cycle. Was there any hormonal involvement was there? Like thyroid profile, have we done already?
According to Ayurveda, you better know during the menstruation there will be pitta dominance will be there. So all the flare of pitta dominance and rakta dushti janya pidakas will flare up during menstruation. That is the reason because of as per Ayurveda, and as per modern, due to hormonal influence. Okay.
Okay, sir. Thank you, sir.
The Raktavastroto Dushti Vikara Shloka is there. Kushta Visarpa
You might
Pida
have
Karashta
seen
Pitta
even
Sargdara.
Mukadushika, etc. They flare up during menstruation. As Agni becomes less in Sharira during that period, because of metabolism, of reduced metabolism, all those things, the Agni will becomes less, the Atvagni. So there will be more Malasanchaya and the Apakka Dhatu formation is more. So there will be definitely flare up in the acne, pidaka and the symptoms also. Okay. This is how you can make guna based samprapti. Okay, we will wind up now. Time is over.
Yes, sir. Yes. There is no questions from any other participants.
Take away message. So this case I was in college. Now I left the college. Last year this case came to my OPD. So my students have nicely collected the data, and we are going to already it is published day for yesterday. So actually I wanted to give opportunity for others, but nobody was prepared, no, because sorry, we have given short notice for all the Vaidyas. Next time please get ready, and only 2 cases will be taken, not more than that, because it will take more time, no. Okay. So today the prayer also we took 7 minutes because less members joined. So next time prayer will be 1 or 2 minutes on spot, means 12 by 12:05 it will be started. Okay. Thank you one and all. Dr. Suraj for moderating the session. Dr. Anuja for presenting, and all the doctors who have involved in the interaction, and those who are not involved also, those who have participated. Thank you for participation, and continue and share your views, and also please you can ask your cases whenever there is a doubt is there. Practicing physicians, I am asking about practicing Vaidyas. You can get ready PPT and present it before the all the Vaidyas. You can also propose your plan. If it is okay, then they will agree, or if something is needed to be added, they will add, experts will add. Okay. Dr. Suraj, is it okay to wind now?
Yes, sir. Sure. Sure. I will thank the Atreya Ayurveda Academy for organizing this wonderful webinar on a case report presentation and case discussion on the treatment protocol planning. I thank the today's presenter, Dr. Anuja, and for prayer song, Dr. Sudha, and almost all the participants who have engaged and who have given their precious time for making this first session was a grateful. So I thank you all. Soon we will publish the next date. Tomorrow. Tomorrow only we will publish the next week the details, how you have to post and etc. Please, watch our WhatsApp
Sir.
group for
Yes,
regarding
1
the
minute.
improvement.
Nobody
Yes.
has asked this. Before Siraveda, we are giving 2 days Grutapana. Third day, we are doing Siraveda after Abhyanga Sveda. Okay. This is almost done in more than 20 to 30 cases we are doing like this only. And also one PhD case, I was guide for Shalya. They have taken Siraveda standardization also we are doing. Means whether to give one group we are not given any, means directly Siraveda. One group Abhyantara Grutapana followed by Abhyanga Sveda. Another group only Abhyanga Sveda and Siraveda. Another 2 days in one group and 3 days in another group. Like that, we are that study is going on. It is actually under Shalya department. I was co-head because of that project is initiated by me, and I am practicing since many years. That one. Okay.
One more thing, sir. My PG studies, my PG dissertation also on the same topic, with or without Snehapana, the Raktamokshana in the in the Gridrasi condition. We did the same condition. We found the results where the Snehana, after that Snehana, whichever the Raktamokshana, the Siravedana is done, we got a very good results as comparatively directly Siravedana. So it was observation during my PG studies and my PG dissertation. So I think so they have given in a classics also. Snigdha Swinna Aturam, the context will start. The same thing, if we will follow, it's some they will quote it as Snigdha Swinna Aturam means only the external they will think.
But internal sneha should be given.
Yes, sir. Internal has to be given.
Yes, for prevention
more
of the
dosha
Vata Prakopa,
utklesha.
as well as best Siraveda results.
Yes.
If you then again there is a confusion is there in Kasturi book also it has not been clarified how much days it has to be given everything.
Yes.
So
Everywhere it is like confusion.
Someone will tell Samex Nidhalakshana, it is not like that. Samex Nidhalakshana it will again go up to the Majja dosha etc. means up to Shukra. So only we need up to the Rakta dosha means dosha which are there in Rakta should get Utklesha. That is the intention. That's why only 2 days. If the Krura Costa is there and doshas are more and Agni is good, then you can give 3 days also, 2 to 3 days, not more than that. So this is the intention. If anything someone has done means still Samex in the Lakshana and they are getting good results, they can share their views.
Yes. Sure, sir. Sure. Okay. We'll wind up, sir.
Yes.
Yeah. Thank you all the participants for this webinar. So soon we will publish regarding the next the webinar case series. It is particularly on a next Sunday. So it's already date is fixed, but the regarding the rules and regulations and how you have to post your the case reports previously to us and how you have to mail etc. We will publish soon. As today or tomorrow we will publish in a WhatsApp group. Okay. Thank you.